Unbalanced hormones happen naturally during the course of aging, but how do you fix it? Well, here to tell us more is the founder of BioTE Medical, Dr. Gary Donovitz, along with Dr. Gil Mejia. Good morning.
Morning.
Glad to have you here. I love talking about this. I love to hear what it's doing for people. Remind everybody what BioTE Medical is.
So BioTE Medical is a company that trains practitioners, doctors, nurse practitioners, how to optimize hormones for both men and women so that no matter what their age, their quality of life is as good as it can be.
We hear a lot about hormones, how important they are. Talk about what it is that you and your team, though, are doing, because it's not hormone replacement therapy. It's very different.
Right. It's hormone optimization. Just replacing some of your hormones doesn't make you feel your best. It doesn't get you off your medications. Optimizing testosterone, optimizing estradiol, optimizing thyroid, as well as supporting the cells with the right vitamins, really can give your quality of life a boost in a number of different areas. We can now do hormone optimization safely. Most people worry about the risk. You should focus on the benefits, like reducing breast cancer, not increasing it, reducing Alzheimer's disease, reducing osteoporosis, and protecting your heart. The #1 killer for both men and women is heart disease, and with hormone optimization, using very small pellets, we can actually decrease the risk of heart disease.
And I think sometimes people miss how important hormones are for those. Talk about risks, symptoms, kind of when people maybe should look at this. What are you seeing in your office? Because you've been offering this for quite some time now, doctor.
Yes, there is a multitude of signs and symptoms for aging men and women. Their energy would be very low, their fatigue, even their brain energy is affected, their memory, their focus, their concentration.
So they kind of just feel like they're in a fog?
Yes,
okay.
Definitely. They have a lot of body aches, joint pains. They have problem with night flush, hot flushes, and their sexual problem too would develop some erectile dysfunction, some orgasm. So it's very important to manage their hormones. As far as when to start it, well, one of the misconceptions is that they think that hormone is only for elderly men and women that's struggling. No, my patients, even women, they start at mid-20s, and men, they start at mid-30s.
Wow. Well, and let's explain what these hormone pellets are, because I want to make sure people kind of fully understand what it is that we're talking about. How do you best describe what it is?
So they're like little small grains of rice. They're actually some smaller than a grain of rice. We put them back here in the hip and the fat. Back here. It's painless going in. The nice thing about hormone optimization with pellets is you only have to do it a couple of times a year. Women maybe 3 times a year. So instead of taking a pill every day or taking creams and rubbing them on twice a day, 2 or 3 times a year you get your hormones and your levels stay constant. You get off that hormone roller coaster ride. It's the hormone roller coaster ride that makes people feel like, gosh, I'm all over the place with my moods, irritability, anxiety, depression. But if you can keep your hormones constant, you can feel your best no matter your age.
Have you heard some good success stories after people have started this and they come back to see you and say, oh my goodness?
Yes, 100%. They're much happier, they're much leaner, they lose more fat, and their aches and pains are gone. Their focus, their concentration, their memory have improved, and their sexual dysfunction have resolved.
Wow.
And they stopped Viagra too.
Wow.
Yes.
Well, you've written a book about this as well to kind of dive into more about this. Tell us about that, doctor.
So the book Age Healthier, Live Happier is really the story of how we went wrong, how we became so unhealthy, and we over-medicated everybody with diet pills and antidepressants and sleeping pills and this whole cornucopia bag of pills we take every day, but it doesn't make us feel better and our quality of life is not better. So it talks about how you can optimize your hormones, how you can feel better, and then get off of your medications. Really, it's the story of what we're talking about today.
Yeah. How do you find out if you're a candidate? How can they come and see you in your office and find out if they can start pretty soon? What would you suggest they do?
If their body is breaking and they want to improve their quality of life, yes, definitely their hormone should be optimized.
Okay.
If they want to improve their career, their health, their wealth, if they want to extend their bragging rights, their hormone should be optimized. Yeah, so we, the BioTE Medical team, are the experts of hormone optimization. We're science-based. We are dedicated to excellence.
Well, we'll make sure and put the info on the screen and how people can contact you. They can also go to BioTE Medical directly, right, and hear more about it as well.
BioTEMedical.com and find a certified provider near you.
All right. Well, gentlemen, thank you so much for coming in today. We appreciate it, and we'll see you again soon, doctor, okay?
Thank you so much.
Thank you so much.